at a wall and put them on your face. We sit down, have a consultation, talk to you one-on-one, and bring things that we think might work for you and see how it fits into your life, like how you use your eyes. And kind of our dry eye spot, it's our second little thing here. It's kind of our hidden one because we can only do so many patients a month because we do spend a lot of time when we do treatments. But we brought that one on about 3 years ago, and I would like to say that I brought it on to be like altruistic and help other people out, but I brought it on because I suffered from dry eyes and I wanted to help myself out. When I was in optometry school, my eyes were actually so dry that when they did one of the tests, they were like, "Oh, you poor thing, you didn't even wet the strip that they put in." And my contacts would get so dry that it'd be like I was looking through a fog, and they would sometimes pop out on their own when I blinked. I subsequently had LASIK, but LASIK can also give you dryness issues, but it was a little bit better than wearing contacts. And even though I was trying to eat real clean, do everything you could, I actually still had signs of dryness on the front of my eye. So one of the reasons why we brought these in, and I was the first test subject on it, and I can say that they work very well. What we'll be talking about today, and I'm going to switch to this side so I can actually see my computer and change things up, is the future of dry eye relief, IPL and RF therapies. So you may or may not have heard of these in the past, and these are kind of the latest treatments that are out there. And we'll first go through what dry eye is, common symptoms, how you test for it, and then we'll talk about the treatment side of things. And if you have any questions, you don't have to raise your hand, just go ahead and ask and we'll answer, so it'll be fairly casual. So what is dry eye? The easiest way to describe it is basically you either don't have enough tears or you don't produce the right quality of tears so that the front surface of your eye isn't coated in a nice uniform tear film. And so sometimes I think of it as like if you have a windshield that's really dirty or it has some water on it, but it's just scattered drops, it's a lot harder to see through that than if you were looking through like something that was nice and uniform. And this is just to give you an idea of how our tear film is structured. So we have, as far as our eyes go, we have these lovely little glands down here. On the bottom of our eye, or bottom eyelid, we have about 20 to 30 meibomian glands, and we have about 30 to 40 on the upper eyelids. And their job is every time you blink and your two lids touch, they squeeze out a little bit of oil that coats the front of your eye, and that oily layer is what keeps your tear film from evaporating off. So for most patients, about 80% of people that suffer from dry eye, this is kind of where we go wrong. So if you can imagine, there's some things that can happen, like say if you're somebody that has an incomplete blink, like you don't blink all the way. A lot of times when we sit in front of the computer, we do this instead of touching, and that leads to dryness. And if this lipid layer isn't where it needs to be, it can cause a lot of these issues, and so we'll go into that a little bit more. So some symptoms of dry eye that you probably think of and you can automatically identify are that stinging feeling, the gritty feeling, burning, and redness. Some that we sometimes don't think about are blurry vision. So if you're not looking through a nice uniform tear film, you're not going to see clearly. And oftentimes it happens when we're in the exam room, and we tend to, our patient population here tends to skew like 35 and older. So sometimes when I'm getting a person's prescription or doing a refraction on them, as it's called, they'll read the line and then they'll be like, "Oh, I can't read it," or they'll be like, "I can't read it," and I say, "Blink, blink, blink," and they blink and they're like, "Oh yeah," and they read that line, and that tells me that, okay, there's something going on, because when you blink, your lids are acting like a squeegee and re-wetting the front of the eye and creating a nice uniform tear layer. But if your eyes are really dry, that oil layer isn't like what it should, breaks up really quickly, and then you can't see as clearly. And then counterintuitively, if your eyes are watering all the time, that's a sign that your eyes are actually dry. So our body always wants to help us out the best that it possibly can. And so when your eyes are dry, it's like, alert, alert, alert. What can I do to fix this? Oh, I know. I'm going to pour in this tear that I can produce, and it's just not the right quality and not the right consistency. So instead of making things better on the front of your eye, you're just kind of leaking all the time, and often it gives you skin issues because you're walking around with a tissue and constantly dabbing. So you get this kind of scaly skin on the sides. And then the other thing is it blurs your vision out because now you're looking through a lake of tears instead of that nice uniform tear film that you actually should have. Definitely exacerbates allergies. So our eyes, they blink, and when they blink, we're squeegeeing the front, and part of what happens when you do that, we have these little puncta, so these little holes, one hole here, on the lower lid, top lid, top lid, and when your lids blink, they take all of that liquid and squeegee it off to the side to those holes, and it gets taken off the front of your eye. So if you don't have enough liquid on the front of your eye, you're not really wiping away those allergens like you should. They have a higher retention time on the front of the eye, so you have more of a reaction to them. And then sensitivity to light. So this is a pretty big one that most people don't usually associate with it, but I was thinking about it the other day, again, when I was driving, and I was driving into the sun, and I had my windshield wipers kind of wiped liquid over the front of my windshield, but it wasn't nice and uniform, and I was like, oh yeah, I gotta fix that. But I almost couldn't see because the sun was coming at me and the glare was so intense. And so oftentimes people with dryness, they'll report light sensitivity, and generally when you're on the more severe side, it can almost be debilitating where it's difficult to leave your home because it just feels so bright to go out into the sun. Eye fatigue, it's just, I mean, every time you're blinking, that lid is coming over like a windshield wiper on the front of your eye. It's tiring towards the end of the day. And then difficulty wearing contacts. So anytime you put a contact lens on the front of your eye, it's breaking up that tear film, which means if your tear film is already breaking up quickly, it's gonna make it happen faster. And kind of like I experienced when I was younger, that when that lens dries out, it gets kind of foggy, or sometimes it can dry out so much that when you blink, it just pops the lens out without you doing anything. And then of course, poor night vision. And because generally you have oncoming lights, you're looking at things that can create starbursts, stoplights, and street lights. And so if you're getting a lot of glare, it's going to make that quite a bit worse. And then other things that make dry eye worse, so digital screens. When we're in front of a computer screen, we tend to blink less. Our blink rate slows down. So that means that one, we're not blinking, so we're not pumping out those oils as regularly, and we're not re-wetting our eye as regularly. So it's a bit of an exposure issue. And then contact lenses, kind of already talked about that one. And then we have hormonal changes. So pregnancy is a temporary one, right? But it can dry you out like crazy. I have had some patients that were perfectly fine before, and then they could not wear their contacts. Even with the contacts out, their eyes, I mean, they were just really, really uncomfortable. And then there's stuff you can't really avoid, like aging and menopause. So gonna get hormonal changes there, and it tends to make us a little bit more dry. Ones that sometimes we can avoid are just kind of being aware of the environment that we're in. If you're in a very dry environment, a windy environment, so dry, it's an exposure issue. Windy, it's an exposure issue. And then the air conditioning and heater, that's generally if you have it kind of blasting right on you, you're having air coming directly at you. And then I'm gonna and then autoimmune diseases, or I skipped medications, so sorry. Antihistamines. So we were actually just talking about this a second ago, but they're meant to dry you out, right? They're meant to keep your nose from dripping, your eyes from dripping, and so they do that by drying up those mucous membranes. And especially if you have like the D versions of them, they're real intense on drying you out. Antidepressants and also some blood pressure medications can as well. So sometimes, these are things that you can't necessarily get off, but they kind of let us know, okay, if we're gonna go and treat and we're gonna talk about things, it gives us an idea for how quickly things are going to change, and just to kind of be aware it may take a little bit longer. And then autoimmune diseases. So a lot of the autoimmune diseases have an inflammatory component, and that's a big component of dry eye. So in particular, Sjogren's dries out your mouth, dries out your eyes, but really usually when almost any autoimmune disease you can think of will tend to make you a little bit drier. And so how do we diagnose it? So the first thing usually happens with actually just talking to people because generally the person will come in knowing there's a little bit of an issue. So like my eyes are dry, they're burning, they're staining, they're watery, like I have light sensitivity, or I'm talking to them and they're just constantly blinking at me as we're having a conversation. And that's kind of your own eye saying, okay, dry, need to re-wet, dry, need to re-wet. So we also have in the office we have an Oculus Keratograph 5M, and it's essentially a device that will let us measure several things on the front of the eye to see how we're doing. And so I pulled and I took off the patient information here, but this is looking at first, do we have enough tears on the front of the eye? And so this right here is a little lacrimal lake, and we have a nice stoplight system on the side, and we want to say, okay, green is good, red is real bad, and then orange is moderately bad. And this patient, they were a bit deficient, and so for one of the things there, we always want to ask, are you drinking enough water? That's step one. If you're not drinking anything, well, yeah, you're gonna be dry everywhere. You're gonna not produce too many tears. The other reason I like this picture is because we see the lashes right here, and this will let me see that lash line. And one thing to be aware of, ladies, is when we put on eyeliner, we always put it on outside the lash line. If you put it on inside the lash line, like right along here, this is where our meibomian glands live. If you put it over there, you're just covering them up and they can't get the oil out. So always on the outside. The other thing this lets me see is sometimes when we have a gland that has stopped working, if you look at the front of your lid, you'll get like a little divot there, and that's because that's gland dropout. It said, no thank you, I'm done, and it's kind of shrunken away. And then the next thing we look at is how long does it take for that tear film to break up? So we talked about, we blink, it re-wets the front surface of the eye, we have that nice oil there. How long does it last? So ideally, we want it to last more than 15 seconds, but sometimes that's not always the case. So we try to do this test. However, I do find in patients that are more symptomatic, it's actually kind of hard to hold your eyes open for 15 seconds and not blink to get a reading because you're so uncomfortable you can't hold it open. So sometimes you can't actually always get this reading, and I can do it a different way in the room because that tear film is breaking up immediately. And so one of the things that this is showing us for this patient is first breakup was around 11 seconds, but on average that tear film was breaking at 13 seconds. So not terrible, but not ideal. And the other thing is so these are just the Myers reflected from the instrument that's actually taking the picture. The way that it measures is since if you have like a nice, if you ever looked at a still lake, you notice how it's like a perfect mirror. So that's how the front surface of our eye is when you have a nice uniform tear layer on it. And so what this instrument does is it sees when those Myers break up, and that's how it gets that breakup time. And then meibomian glands. So what do they look like? So this is the lower lid, and it's flipped over, and we should have like 20 to 30 glands here, and you can kind of sort of see that there's something there. So this is a pretty severe one. This is like what they should look like, what you can compare to. So these, I like big, fat caterpillar glands. Those are your friend. They light up nice when you take, and this is an infrared photo, so they light up nice when you take the photo. They go back all the way the length of your lid. Those are gonna do great for you. And then we have these. They just still do okay too. These were getting a little like, And this is very difficult to treat when we get to this point. So usually treating when we're here or here is actually better, because what we're trying to do with these therapies is basically reset your own system, get your own eyes to do the work for you. But when we get to here, it's like, oh, we don't really have much left to work with. You kind of, we've got a few glands, and then this poor person, I mean, it's hard to even tell that there are glands there. But even if you're over here, another thing that we do is I'll squeeze on those glands because we see they're there, we see they're filled, but let's see if oil actually comes out of them. And if oil does come out of them, is it a nice consistency? We want it extra virgin olive oil so it easily coats the front of the eye, or is it thick like toothpaste? So, or does it just not come out at all? That's also a possibility, because when and this happens a lot for people that work in front of a computer long hours, you're not blinking as much as you should, you're not pumping those oils out regularly, so what happens? That oil stagnates, and now instead of being extra virgin olive oil, it turns into candle wax. And it's actually a plug instead of helping you out. And then we also measure the redness in our eyes. So admittedly, every eye when you look at it, it does look a little red. We do have blood vessels on it, but this is a particularly red eye. So our eye's reaction to anything it doesn't like is it turns red.
It's mine all the time.
Yeah. I have some patients joke that I'm very patriotic because my eyes are red, white, and blue. And I'm like, oh, that's so sad. And so generally in eye dryness, there's a big inflammatory component. So your eyes are dry, they get red, they get inflamed, and then it makes harder for everything that's supposed to be producing that tear film to work. So it's just kind of this negative cycle. So the question is, what do we do about them? So that's where we'll talk about the treatments, specifically IPL and RF, how they help with this, and why we combine them. So IPL is intense pulse light. I like to think of this as the foundation. Who here has ever seen My Big Fat Greek Wedding? Okay, I got like 2 people. Okay, well there's a dad in My Big Fat Greek Wedding that has Windex, and he likes to use it for everything, right? That's how I feel about the IPL. Because it's targeting inflammation, it's good for so many things. So this, if we think of this as right around the eyelashes, if you have a lot of inflammation there, it's kind of choking off the gland, it's making it harder to work, it makes your lids red, and then oftentimes I'll see patients that it's like they look 50 here and 60 around the eyes, because the skin around the eyes has a cracked, dry earth appearance to it. And that's kind of inflammation going on right there. As usually we'll find by treatment 3 with the IPL, it looks fabulous. But it reduces inflammation, and that's kind of the really big way that it improves gland function. And it improves rosacea. So rosacea is the redness in our cheeks. We usually treat kind of down onto the cheeks a little bit, because if you have lots of inflammation here, and then you have this big reservoir right here, if we treat right here and we kind of leave this alone, well, now you have a sink of inflammation that's just going to feed into the eye. So we find that the effects last longer when you go down onto the cheeks a bit.
Question. You need to then go your whole face, because it's still it's gonna eventually have a reservoir anywhere, right?
Sometimes you can, and sometimes we do.
Okay.
It depends on the severity. So in the and we do it when it is a dry eye related thing though. But so it also it improves acne. So it's not one of there are different settings that you can use for the IPL, and that's not necessarily what we set ours at, but it is kind of a nice minor side effect that you do get from it, but our setting isn't specific for acne. It rebuilds collagen. So the whole process of how the IPL works, it's about a 4 to 6 week process, which is why every time you come in, it's not just one day, next day. And it makes you glow. So the IPL is intense pulse light, it's scattered light, it is not a laser. So it's going from wavelengths of 590 all the way up to 1100. And it is targeting redness. That's specifically what we use our filter for. Because what we want is all these blood vessels that you saw around here, when we have inflammation, a lot of that comes from abnormal blood vessels that are coming off of those that are dumping inflammation into that area around the eyes. And so when we treat with IPL, what we're doing is we're heating these blood vessels so that they will apoptose or get rid of themselves. And generally there's kind of like a network or a net of them, which is why you need multiple sessions, because we cull one layer, now we can get to the next layer, we cull the next layer, and then the next layer, and then the next layer. And usually for your first session, that's when you'll feel the IPL the most, just because your skin is the most inflamed and has the most redness. But generally after that, since we're getting rid of the inflammation as you go, you don't feel it. But having said that, it shouldn't hurt. It just feels like a minor heat or a little bit of a rubber band snap on the skin. It also has photobiomodulatory effects, which means that it stimulates the cells around your eyes to work better. And this is partly why it helps with dryness as well, because you're getting all those cells that are around the eyes to do their job better, to produce a better tear film. So it affects the mitochondria and stimulates it to work a little bit better. And then other things that this is great for, but this talk isn't necessarily about, we talked about one is for the skin around the eyes that looks kind of scraggly and cracked from inflammation. The other one is styes. We use different settings for it. It tends to be a bit more intense because it's a big red blob and it's targeting that redness. But if you have a stye that's really big, you come in, we'll zap it and put you on a steroid antibiotic combo, and generally it'll calm down. 80 to 90% of it will be gone within 3 to 4 days. So if you've ever had a stye and gone through that before, sometimes they can last for months and they tend to be recurring. So it's a really nice option to have. And then the next one is radio frequency, so deep gland stimulation. So it does, and for this one, because it's breaking everything down, that's kind of, you have that 4 to 6 window to get the collagen rebuilding. So it does have some aesthetic effects, but that's not necessarily why we're using it for this. It was originally used in aesthetics, and then they were discovering that some people were seeing improvement in their dry eye, and then that's when they started the studies to figure out what settings to use for dryness. So radio frequency, those oil glands that we were talking about, those meibomian glands, it uses radio waves to get deep enough to heat those glands, to warm the oils so that we can expel them out. So for this, I really like it also because it has the skin tightening and there's a wrinkle reduction effect as well. And because it is heating, it's causing a lot of extra circulation to go around the eyes. So you do tend to be a little bit red for 3 to 4 hours, but it fades as your skin cools down. And so when you have extra blood flow to that area, it lets you flush out a lot of toxins in that area as well. And so this is kind of how we manually, and we'll do the lower eyes and we do kind of the upper brow, and we've played with our techniques enough now to where we don't make you wear the corneal shields anymore, which I know everybody's excited about. Nobody likes the corneal shield. So we used to put in a little plastic looking contact lens over the eye, so then you couldn't see anything. New stuff was going around out in the world. It did freak quite some people out being in the dark for that long. But anybody have any questions on the radio frequency? Yes, sir.
So I'm guessing that IPL is the more intense one. Is that the case comparatively?
When you say intense, what do you mean?
I mean, if you have severe dry, which one would you recommend? Is one more intense than the other?
I think the IPL is the foundation, so we'd always do the IPL, but the RF kind of helps things work a little bit quicker, which is why we generally use them in combination because they work better as a team.
I see.
As for the IPL, it kind of has a long burn. Generally, if you do just the IPL, it takes quite a few sessions before you notice it, but when you combine it with the RF, then you notice things a lot quicker.
And would you do them both in the same session?
That's typically how we do it. I like it too because the IPL is already heated at the skin, because for this you have to get to a certain temperature and stay at that temperature for a certain amount of time. So if you start with cold skin, it just like, you're sitting there forever.
Okay. How long does each of them take, like each session?
So it depends. So the first session usually takes about an hour and a half because you have to fill out all the consent paperwork, and we'll do the IPL, the radio frequency, and we generally add on the Rinsada and the Zest because that will give you a really nice effect a lot quicker. Because again, that IPL, it takes a long time, that whole 4 to 6 weeks process, and the RF is kind of the same thing. There is a bit of a lag time. Immediately after you do it, it's emptying out the oils in the gland. So sometimes you can actually get a little bit of dryness because you have to wait for those oils to refill. So the Rinsada is, we take a little syringe, and with the other ones, we're working on the outside of the eye. With the Rinsada, you've had all this inflammation going on inside the eye, so we basically just rinse it out. And that lasts for about 90 days. And then we take the Zest, because the other thing we want to do is remove any physical obstructions that are keeping oil from getting out of the glands. So it's like a deep clean of the eyelids. We actually clean along the lid margin. Can some get in your eye? Yeah. Does it sting just the hair? Yeah. Will it hurt your eye? No. So the eye may be just a hair red afterwards, but because you use a rinse for it, it generally feels real good when you do it. It just feels nice. I can ask for it. So we try to add these on to the first treatment, so you get that really nice feeling of relief immediately, since the IPL does take a little bit longer. And the treatments build on each other, because for the radio frequency, I often think of it like if you had a really dirty pot with a bunch of stuff caked on, and then you emptied it all out, you rinsed it, and there's still gonna be stuff there, and so you empty and rinse a couple of times, and then that will give you glands that are producing really good quality oils by the end. But it is a little bit of a process. And then kind of, why do we use multiple treatments? Kind of to your question, is there are a lot of other factors that can go into it. So the IPL reduces inflammation, the RF clears out the glands, and it stimulates glands, and it increases blood flow, and the Zest removes the biofilms. It's also, they like to talk a lot about how they use okra in it and how it's anti-inflammatory. And so it does have an anti-inflammatory component. And then again, the Rinsada to rinse out the orifices inside. And IPL, again, takes time, which is why we try to build on the other. And we generally do this in packages, because we find if you do just one, you tend to forget to come back and do the others. And you need to go between a 4 to 6 week window. If you wait past 8 weeks, then it's kind of like, well, we're kind of starting from scratch, because those blood vessels have grown back. Things have gone kind of back to the way that they were. And then, does anybody have any other questions?
The only thing I was thinking of after you, because my doctor said that I have crying tears, but I don't have wedding tears.
Mm-hmm.
Can you explain that?
So that's kind of what we were talking about in your
beginning.
eye will water, but it's not the right kind of tears. So they tend to be a little hypertonic, a little bit saltier. They don't have the same oil level that you should have in the others, in the tears that create that nice uniform layer on the front of your eye.
Yeah, because they tried putting me in contact, and I actually got one stuck in my eye and had to have it removed.
Yeah.
Because they said I didn't have enough tears to keep, even though I was putting bottles of wedding solution on.
And so that's the other thing, is like, well, can I just use artificial tears? Well, yes, you can, but like, you notice the artificial tears, they're there to replace that tear film layer, and because we do this lovely blinking thing, they're washed off the front of the eye, usually in like 30 seconds to a minute. Or sometimes the other options out there are are drops that you're kind of on forever for a lifetime, I tend to take a little bit more of a holistic approach. I'm like, if I can reset my own system to get my own body to do it for me, then I would rather do that than have to be on a drop every day. Because usually those drops can be fairly expensive and they tend to sting, and they have, you know, other drawbacks to them.
Yeah, so my option, what I did is say, no contacts.
Yeah. And that is, you know, sometimes what ends up happening. Sometimes I have contact lens wearers where they're like, I can't see well. I'm like, your eyes are real dry. I got an option for you.
And
And
they're giving me injections in my eyes.
oh, that would be for something slightly different. So that would be for macular degeneration. We have a talk on it in May.
Anyway,
So-
that was just a comment.
So then we'll talk about kind of the package options and how we usually do it. So generally, this is the one that most people do because this is going to give you the best value. And we want to have multiple treatments multiple times. Usually, we have kind of maintenance programs after this, but generally I find when you do this, most of the time you'll just need a treatment once every 6 months or once a year. And kind of after this, I'll give you the kind of thing, the homework that I recommend. Because the better you do the homework, the less likely you are to need the management treatments or the further out that they can be spaced. But this is the one that, again, it gives you like everything you're doing. The 4 IPL, you're doing the Zest, you're doing the RF, and the Zest is once every 6 months, and the Rinsada is once every 3 months. And then for this one, this is more for kind of mild to moderate dry eyes. And one thing that I forgot to mention with the IPL, and one of the reasons that you got that sheet, is IPL sees color. So my skin tone's a little bit dark for doing the IPL right now. It can cause hypopigmentation. You also can't do it if you've had skin cancer right in that area. We also don't want to do it if you have melasma in the area that's to be treated, because sometimes it can make those spots a little bit darker. So those are things to just kind of be aware of. And that's why we have both too, because sometimes you can't use one, you have to use the other. For radio frequency, to produce those radio waves, it does create an electric current. And so, if you have any sort of electrical device like a pacemaker, or sometimes people will have a spinal implant, you have to turn the spinal implant off. And if you have a pacemaker, well, we can't turn that one off. We just can't do that. And so then those would be converted to just IPL only treatments. So that's why we have both. Because part of my thing was like, well, you know, I don't think it's fair if you have a darker skin tone, you can't get treatment with the IPL, so we brought in the radio frequency. And then your homework. So this is homework that with these treatments I give, you can start it before. Lid scrubs, they should pay me, but they don't. But so lid scrubs or lid wipes are basically these little things that you can find at the grocery store. They're called either lid wipes or lid scrubs when you go in, and you use them on your eyelids and lashes, only on the outside. You go back and forth 10 to 20 times. You'll generally want to use them at night before you go to bed. It's good for getting all the allergen off, so if you're having allergies, they're fantastic, and they help clean off any debris that's on the lid. And then you use them in the morning when you wake up to get anything that's left there. My favorite brand is Optical, but you can only get that one online. OcuSoft you can get in the grocery store. It's available at pretty much any H-E-B.
I use that Wash and Long eye wash. You wash your eyeballs with. What do you think about that?
Thank you so much.
I mean, that's good to get debris out, but I wouldn't say that would be something for dryness. And then warm compresses. So warm compresses are good, but the skin around our eyelids is very thin. It's going to be the thinnest skin in your body, so it can't heat to the same temperatures as the radio frequency. You'll scald and burn your skin. And then Danielle, if y'all wanted to get set up in the back for the demo. We are ready. All right, Rory, if you wouldn't mind going for the demo. Yeah, awesome. And then other things, look at your environment. So if you're any wind, that basically can make it so it dries you out. So if you're sleeping under a fan, under a vent, if you have an air filter, a CPAP. So CPAPs tend to be really big culprits. They're supposed to shoot air up your nose, but they always get some leakage will go up to your eyes. And even if you're wearing a regular sleep mask, you're still gonna get some that's lifting those lids and causing some exposure issues. So generally, if you have a CPAP, I always recommend a mask called Tranquil Eyes because it's like a pair of goggles, and so it'll keep that air from getting in. It does mean now you're kind of sleeping with your eyes covered, your face covered, so it is a bit of an effort if you want to actually get up and go to the bathroom. And then Andrew, could you tell her they could come in and start singing?
Yeah.
And then drink enough water. So this is a big one. You know, we can do all that we possibly can, but if you're not drinking enough water, you're gonna be dry. The other big thing is I had one patient who, she was great about everything, but she would always get up in the middle of the night and look at her phone. And I was like, you can't get up in the middle of the night and look at your phone for 2 hours. The nighttime is when your eyes are supposed to be closed in a nice, warm and gushy environment to reset for the next day. I was like, I could treat you every month for the end of time and your eyes are still gonna feel dry because you have to get the proper amount of sleep. So that's a big one. And then avoid processed foods. So we want to try, and I always recommend a whole food plant-based diet. So you want to try and skew that way as much as possible. So when you're eating whole foods, you're generally eating things that are not dried out. So they have more liquid in them. So you're already starting out kind of ahead of the curve. And then we want to try and avoid processed foods, again, because they tend to be dehydrated. They tend to be oily with not so great oils, which also means that they're more likely to contribute to inflammation as well. So want to be cognizant of what you put in, because again, I can treat you every month, but if you're just going out and eating like McDonald's every night and not drinking a sip of water, it's not going to do too much after the initial treatment. It'll last for a little bit, but it's not going to last for a long time. And any questions? Yes, ma'am.
Do you guys use HSA or FSA plans at all?
We do.
So it would count under that.
It would count under that, and we also have care credit